We'll be doing chapter 14, spinal cord and gross anatomy. An average adult spinal cord is approximately 3/4 of an inch in diameter and range between 42 and 45 centimeters in length. It's cylindrical in shape and extends inferiorly from the medulla oblongata, which is located in the brain, through the vertebral canal and into the inferior border of L1 vertebra. The tapering inferior end of the spinal cord is called the conus medullaris, which marks the official end of the spinal cord proper. They have two localized enlargements that provide innervation to the limbs. These areas of the spinal cord are wider than other areas of the cord because of the greater number of neurons that extend from these enlargements to innervate the upper and lower limbs. The first enlargement is the cervical enlargement, which is an enlarged region of the inferior cervical part of the spinal cord. The second enlargement is the lumbosacral enlargement, which is an enlarged region of the mid-lumbar part of the spinal cord. The cervical enlargement contains the neurons that innervate the upper limbs, and the lumbosacral contains the neurons that innervate the lower limbs. The spinal cord is subdivided into 5 parts that is associated with 31 pairs of spinal nerves. The cervical part is the superior most part of the spinal cord. It is continuous with the medulla oblongata. The cervical part contains neurons whose axons contribute to the 8 pairs of the cervical spinal nerves. If you look on page 538, figure 14.1b will show you these structures. The thoracic part lies inferior to the cervical part. It contains the neurons for the 12 pairs of the thoracic spinal nerves. The lumbar part is a shorter segment of the spinal cord that contains the neurons for the 5 pairs of the lumbar spinal nerves. The sacral part lies inferior to the lumbar part and contains neurons for the 5 pairs of sacral spinal nerves. The last part of the coccygeal part is the most inferior tip of the spinal cord. 1 pair of coccygeal spinal nerves arises from the part. The spinal cord in an adult is shorter than the vertebral canal that houses it. The rootlets of the more inferior spinal nerve includes L1 through L5, S1 through S5. They extend inferiorly from the conus medullaris. Collectively, they are called the caudae equine, which is also known as the horse's tail, which is this part here at the bottom. They are named this because they are referred to because they resemble a horse's tail. Within the cauda equina is the filum terminale. It's a thin strand of pyometer that helps anchor the conus medullaris to the coccyx. The spinal cord is divided into 31 segments based on the origin of the spinal nerves. The cervical nerves exit just above their corresponding vertebrae. All other spinal nerves exit just below their corresponding vertebrae. The spinal cord conducts sensory signals up to the cord, conducts motor signals down the cord, and integrates certain reflexes. When viewed in cross-section, which you can refer to page 539, figure 14.2, the spinal cord is roughly cylindrical, but slightly flattened both posteriorly and anteriorly. Its external surface has 2 longitudinal depressions, a narrow groove, the posterior median sulcus, deep internally and on the posterior surface, and a slightly wider groove, an anterior median fissure. The size and shape of the spinal cord changes along its length because the amount of gray matter and white matter reflects the function of that part of the spinal cord. Gray matter is a butterfly-shaped structure that occupies the central portion of the cord. It consists of cell bodies of the interneurons and motor neurons, neuroglia cells, and unmyelinated axons. White matter surrounds gray matter and is divided into 3 columns named anterior, posterior, and lateral funnels. It consists almost entirely of myelinated motor and sensory axons. For example, the spinal cord parts that control the upper and lower limbs are larger because neuron cell bodies are located in that area, and more space is occupied by axons and dendrites. Okay, now we're going to move on to protection and support of the spinal cord. The spinal cord is protected and encapsulated by spinal cord meninges, which are continuous with the cranial meninges. They have 3 layers of meninges, which are the dura mater, the acronoid mater, and the pia mater. The dura mater is the outermost layer of the meninges that is composed of dense, irregular tissue. The dura mater provides stability to the spinal cord. The epidural space lies between the dura mater and the inner walls of the vertebrum and houses adipose tissue and areola, connective tissue, and blood vessels. Epidural anesthetics may be used to lessen pain during childbirth and are introduced into this space. The pia mater is delicate and closely associated with the spinal cord surface and known as the innermost meningeal layer. It is composed of elastic and collagen fibers that support some of the blood vessels supplying the spinal cord. Dentelicate ligaments are paired lateral triangular extensions of the spinal pia mater that attach to the dura mater. These ligaments help suspend and anchor the spinal cord laterally. The pia mater extends from the inferior end of the cord as the filum terminale, which serves to anchor the spinal cord inferiorly to the coccyx. The acronoid space lies external to the pia mater. It is partially composed of delicate web of collagen elastic fibers termed acronoid trabecula, directly deep to the acronoid cerebrospinal fluid. The subdural space is potential space between the acronoid and overlying dura mater. The spinal cord is also protected by bones, discs, ligaments, and muscles. The spine is made up of 33 bones. The spinal cord passes through a hole in the center of each vertebrae, which is known as the spinal canal. Between the vertebrae, there are discs that act as cushions or shock absorbers for the spine. Ligaments and muscles help keep the vertebrae in the correct position. There are many pathways or tracts in the spinal cord. The motor tracts in the spinal cord are found in front of the middle parts of the cord. The nerve paths allow movements of the arms and legs. If there is damage to the motor tracts, weakness or being unable to move may occur below the level of damage. The sensory tracts in the spinal cord are found in the front and back parts of the cord. These nerve paths allow sensation. Damage to the front part of the spinal cord can result in loss of ability to feel pain, as well as hot and cold sensations below the level of damage. Damage to the back part of the spinal cord can result in the loss of ability to feel the sense of position of the arms and the legs.